the key take-home message from our study is that there are distinct differences between males and females in terms of bicuspid aortic valve disease, and these differences should be taken into account while making the clinical decision for these patients, as well as for the further research and basic science studies. I'm Talha Nias, and I'm a third-year pediatric cardiology fellow at Mayo Clinic. The title of our study is Sex Differences in Children and Young Adults with Bicuspid Aortic Valve Disease in First 2 Decades of Life, and this will appear in an upcoming issue of Mayo Clinic Proceedings. This is a retrospective cohort study, which initially included 1,010 individuals with bicuspid aortic valve under the age of 22 years. And then we subsequently identified 558 individuals with pure bicuspid aortic valve and no other congenital heart defects or other diseases that would confound the results. And we utilized these 558 individuals for the purpose of this study. We subsequently identified the differences in terms of males and females about the morphology of the aortic valve, the function of aortic valve, aortic dilation, as well as the outcomes and the progression of the disease process. When we looked at the differences in terms of the morphology of gust fusion, there were no distinct differences. However, when you look at the function of the valve, adolescent males after 17 years of age and onwards had a higher degree of aortic valve regurgitation as compared to females. Another very important difference between males and females in patients with bicuspid aortic valve was the aortic dilation. Males had a larger ascending aorta and sinus of Valsalva dimensions, both as an absolute dimension or a z-score throughout the whole study. And in fact, in males, the risk for sinus of Valsalva dilation was about twofold as compared to the females. In addition to this, we also had a very interesting and novel finding, which was the peak aortic dimensions or z-scores. These were present around 8 to 10 years of age, and these were only present in males. Now, keeping in mind that these were z-scores, and although these were really high around this time frame, they did tend to go down and plateaued over time, although the absolute dimensions keep on coming up. But it was interesting for us to identify that only males demonstrated this peak growth of aorta around 8 to 10 years of age. The key results from our study, the way they apply to the patient care, primarily are the fact that there are distinct differences between males and females. And whenever we are making some certain clinical decisions, whether this is treatment decisions, whether this is follow-up time frame decisions, or this is about sports participation, all of these should include and take into account the fact that there are these differences present among these patients. Here at Mayo Clinic, we take the approach of precision medicine, and the idea of care for patients with bicuspid aortic valve is to make sure that we are taking into account multiple different factors, whether that is differences in terms of males and females, and certain other aspects. And our goal is to provide an absolute best care to the patients based on these differences, keeping in mind of our idea of precision medicine. The main research ideas that come out from this study, which will provoke further studies, is this novel finding of peak aortic dimensions that were only present in males. It does provoke certain ideas, like hormonal differences between males and females that could be contributing to this. And therefore, we will be looking into some of these differences going further, and will hopefully generate certain more ideas into the basic science aspect of aortic dilation. And in fact, if we find these distinct differences to be significant in our basic science studies, could be a therapeutic target in future as well. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us Our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.